that it has not been and it never will be. I will not take time to introduce all our speakers. As they take up their questions, they will introduce themselves and give us a little bit of an idea of their background and what they represent. There are two moderators, and I'm starting with education. Indeed, hello, we're only going to have one session, and I'll ask everybody to please give us their attention so that the side remarks don't interrupt us. Thank you very much for your understanding. My name is Onyeka Onwenu. I'm the DG of the National Center for Women Development. Once a girl child, and actually spent my formative years during Nigeria's civil war. And so when I talk about the girl child, I speak the difficulties of the girl child in time of crisis. I know what I'm talking about. During that time, education was put to a halt for 3 years. In that part of Nigeria where I came from, in the southeast, there was no schooling. And all the vicissitudes of terror and bloodshed and insecurity we experienced. It is not what we want for the Nigerian girl child, and we never want their education to be interrupted. But there's no doubt about it. The statistics show that the majority of children out of school are girls. Indeed, with recent events in the northeastern part of this country, you don't need to be told that parents and the girl child, that everyone is scared about going to school. But this is even the more reason why we should hold this session and why we must come up with solutions. I'd like to ask members of the panel, and at this point, if you feel led to take on any of these questions that I'm throwing out, to give us an answer or a follow-up, feel free. But I'll implore you that we just have 8 minutes, as much as possible, to each answer, because answers would elicit more questions. There's no doubt that we need to accelerate progress in girl child education, but at the same time, we must consider equitable education for all children. So we are indeed talking about education for all children, but how can we, in the midst of that, ensure that we accelerate progress for the girl child as far as education is concerned? What can we do, and what can we do immediately? Feel free. And we need a microphone for the speakers. Microphone for the speakers. In the meantime, before it arrives, we will share this one. Minister for Health, what can we do immediately? You're coming out of an extraordinary experience of handling the Ebola crisis that was thrown at us. You handled it successfully, to the admiration of the whole world. And in the midst of it, schools were to start. So I'm coming to you with this first question. Combining health and education, what can we do and do immediately to ensure that the girl child, her progress is indeed accelerated?
Thank you very much, DG Onyeka Onwenu. Let me start just, since I missed out on the opening, apologize for that, but I'm sure you understand why I couldn't make it. But all the while my heart was here, and I want to commend you and your team. Of course, Akudo Ikemba also partnered with you and with our organization, Friends Africa. So well done, and congratulations, Nigerian women, on this epoch-making summit. I think the immediate thing first is to showcase what girls have been able to do in their various homes and in the nation. You talk about Ebola. Ebola virus disease we've won a major battle. The war is still on. The enemy has retreated. Who knows whether it's reinforcing? And so we're also remaining vigilant. It's very important to tell Nigerians so that we've won the battle, but not the war. The war is still on. Kind of a ceasefire in Nigeria, which the whole world is commending because we're able to deal decisively with it in the first battle. So we need to remain alert. But women played a major role there. That is the point I'm making. Women played a major role. Some of them were martyred in the fight. For instance, Dr. Adedevo and two, a nurse and the ward orderly. These were women. So we need to showcase the role of women in every success, whether it's at the national level or in the family. Now, time was when parents would do anything to have a male child. Now, gradually, that is changing. Because from the experience of people who have had even 7 boys and just 1 girl, they tell me the girl is now the pillar of the family. We need to project that. And the more we did that, people begin to know that it doesn't really matter. It could be a boy, it could be a girl, and that girls may even turn out to be more valuable in that sense than the boys. So I think this is something we can do immediately. Second thing, I think, is that we can work on political leaders. Already we have a gender-friendly president, so it's not going to be too difficult at the present moment because we have such a president. So using him and some other gender-friendly leaders, such as the speaker, I think a lot can be done. A lot can be done in terms of encouraging schools, some of them girls' schools, put in the necessary facilities, give scholarships to the very brilliant ones. And let me say something. I'm a teacher, though a teacher at the university level before I came into politics. That's why, sometimes they preface my name with the title professor. So I'm a teacher. And I can tell you that right now in medical schools, the girls are taking over. My prediction is that there's going to come a time, it's already happening in my alma mater, University of Lagos. When I was in that medical school, we had only 1 hall out of 8 for the girls. Yeah, they used to be called halls. No, I think these days they call them hostel. That's how bad things have gotten. They used to be called halls in my time. So please, when I say hall, it's not like this hall. Those were halls of residence. So out of 8 halls of residence, only 1 were for the girls. Today, I'm told it's almost equal number. I don't know what that means. But certainly time will come when the boys will start asking for their own, you know what I mean? So I want to stop there since it's a panel so that others can also lend their voice.
Thank you very much indeed. After your comment, is it on the same subject? Yeah, go right ahead. Please introduce yourself a little bit.
Good afternoon. My name is Tokumbo Sharo. I'm the director of the Owando Foundation. What the Owando Foundation, what we do is we basically adopt schools across Nigeria. We currently have 47 schools adopted across Nigeria. And when we adopt the schools, we ensure the infrastructure is right. We put an ICT center in. We put an early child care center in. We give scholarships to 10 kids in each of our adopted schools to go to secondary schools. We train the teachers. We work with the SBMCs and we work with the LGEAs because they're responsible for public primary education in the states. For me, to make it equitable, you have to look at the demand barrier and you have to look at the supply barrier. And we must not guesstimate what it is in an urban area and what it is in a rural area. We need to do our homework to find out why these girls are actually not going to school in the different areas. Because one solution might not solve everything. Advocacy is a big thing. We need to work with the communities to ensure they understand why a girl child has to go to school. We also underestimate teachers. Teachers are so influential in a child's life. So we need not just training the teachers on how to teach, but how to also mentor the girl child to ensure not that they just do the education, but they stay in school. It's very, very important. So for me, that's what I want to say for now.
Thank you. Does anyone else have a comment? Just pass it right through.
Dr. Salma Abbasi, CEO of eWorldwide Group. I totally echo with what the Federal Minister has said and what my colleague has said. I want to take it a step further, that we've been working in Nigeria for nearly 20 years, and some fundamental things are missing in the concept of equity for girls, and that is the governance. Policies and bills and acts are not in place to address the challenges that are there, as you mentioned correctly. Each community has different challenges, cultural, social issues that need to be overcome. It's wonderful to sit here in Abuja and say we want more girls to go to school, but we have to practically understand the issues that are marginalizing girls' attendance in school. Obviously, first with the communities, bringing on board the risks and the fears that the traditional leaders have.
Exactly.
Maybe at the grassroots level, there's a lot of politics going on, a lot of misinterpretation of the values of their religion, or of the fear that this is going to happen to the girl. If she goes to school, she'll become a rebel. So what we have to be able to do is highlight the success stories that are happening, the case studies of the communities of when the girl was educated and she was married. This is what happened to the family. This is what happened to the children. Many people this morning mentioned the fact that an educated woman is an educated household. But one thing that I feel is a risk that we face is that when we write policies and we come up with wonderful initiatives, we simplify what it is marginalized. We simplify the word, the girl child. The girl child is a child that could be an orphan. She could be the child of a widow. She could be a child with disabilities. There's many, many categories, and for each of those categories of the young, innocent daughter of mine, we have to come up with a strategy and a plan and the policies that actually allow her to go to school. We have to earmark money. We need, we in America you say, well, put your money where your mouth is. The president is fantastic and has really done wonderful things for women in Nigeria. But now I think we have to earmark money and use ICTs, as my young friend is going to say, to actually show transparency and impact. You can use the media to help you see how a transformation has happened in a girl's life. Thank you very much.
Thank you. Yes.
Thank you, DGNCWD. She's asked some very important questions. I think we're both seeing that more and more it's a good idea that we've collapsed these sessions because there's so much overlap between health and education. And indeed, we're brainstorming here on what the synergies are. I have questions about ICT, questions about immunization rates, questions about nutrition. So as a result, I'd like to just pull in a few people. Dr. Amazigo is here. I'd like to get your thoughts on child nutrition, the connection between child nutrition and education. How can the education sector be used to improve child nutrition rates, as well as to administer drugs to the children that prevent worms and some of the neglected tropical diseases? Tell us a little bit about how the education system can be a really good tool to improve child survival rates, decrease morbidity rates, and improve their overall nutrition.
Thank you very much, Akodo. I used to be with the World Health Organization, and I served the World Health and the very rural communities, 146,000 communities in sub-Saharan Africa for more than 17 years. So my life has been always with the rural poor and adolescent girls and the children. Now, I think one thing we need to do is to go back and rethink, revisit the policies and the implementation strategies we have had so far. To get it right, we must at least try to listen to the poor, listen to the girl child, create a forum like the one you have now today, where we can annually or 6 monthly bring them in Nigeria, in different parts of Nigeria, and create a forum where we can say, this is the Girls' Child Forum, and we listen to them. When we listen to them, let us also try and give them a town hall possibility where we can ask the girl child questions, and the girl child should be able to tell us where it pinches them, and we should be able to tell them what our challenges are with regards to what we want to do for them.
Okay.
So listening to them is extremely important. Now, coming to nutrition, we found that, let me summarize what I want to say on nutrition. We are doing school feeding in Enugu and Anambra State, showing how the communities, the poor people, those we consider poor in Nigeria, they're managing to feed 750 children every day with highly nutritious food. And they're being supported by 2 private sector firms, and then the government is providing the policy and the technical support. But the communities have created community fund to support nutrition, because we showed them that their children, within 4 months of feeding them with highly nutritious food, just milk, mothers, if we can give children in our schools a cup of milk, 1 egg, and 2 slices of bread every week, twice a week, you will improve the stunting, the underweight in children by more than 30% within 6 months. And so we were able to move children that were underweight, stunting, within 4 months of giving them good nutritious food like bambara nut with crayfish and so on. But the story I want to tell you, and I want to summarize there, one of the little boys took his own egg and hid it in his bag. 6-year-old boy in elementary 1. When we caught him and we asked him, why did you hide your egg? His response, I'm taking it to my mother. I've never seen her eat egg.
Auntie?
Hey, that shows you the level of poverty and the neglect we have given to women in the rural areas, to their children, and to the girl child. So if you can introduce school feeding, no matter how small, and it's inexpensive, with less than 175,000, you'll be feeding every week 500 children. And every day of the week, with their mothers cooking for them, serving them, washing plates.
Thank you.
So there is so much we can do with and
Dr.
improving their
Mazigo,
health.
thank you so
Thank
much. You know, that has really sent the message home in an incredible way. And I think a lot of questions will come to you. I'd like to pull in some of the other speakers. We have Dr. Mandara from the Gates Foundation, Country Director for the Gates Foundation. Now, Gates is probably the biggest funder of global health globally. And they're always very concerned about maternal health and the health of the child. Meru, can you tell us a little bit about where you see the interconnects between education and maternal mortality, or maternal survival and child survival?
Thank you very much, Akudo. The linkage between any section of health and education actually is most pronounced when you look at maternal and child health. And from our recent and previous DHS in the country, Demographic Health Service in the country and other places, what has been found is that the most important or the most significant thing that affects the health of the mother, the health of the child, the nutrition of the child, whether the child lives for the next 5 years or not, is not actually how wealthy the parents are. It's actually how educated the woman is. And completion of secondary school has been found to be the most significant variable that determines maternal health, child health, whether or not the woman decides to use family planning to space her children. The whole reason why this is so is because a lot of us have knowledge. We all watch TV, we all listen to the radio, we listen, so we have an idea of what is right and what is wrong. But the problem is moving knowledge to action. That is an indication of level of education. So for me, even as I'm an obstetrician gynecologist, if there's any one area I would say that we need to invest as a country is the education of the woman beyond investments in health. I'm sorry, Honorable Minister, even as I'm a doctor. Because if you educate a woman, the level of disease is reduced, malnutrition is reduced, she is able to immunize her children don't die because of measles, because of meningitis. She's able to know that in between a child, she needs to spend something like 3 years, so therefore she uses contraception. So for me, that is the crux of the matter. And beyond what we think, this has been consistently been shown in the data in the Nigerian DHS. Education, education, education. But I personally have a slightly different view on who is responsible for education. I think every single one of us that is sitting in this room, the fact that we understand even Pidgin English, it is our job.
Yes.
It is our job to make sure that every single girl child we come across, not my daughter, not my relation, not my sister, that it is compulsory for me. Every other girl we come across, we have to find a way of making sure she's educated, not just educated, but well educated.
Thank you. Talking about family planning. In the old days, our grandmothers did it differently. They had their methods, most effective methods. And we lost all that. And then we started again bringing it into public discussion. I actually did a song with King Sunny Ade. If you love me, you go wait for me. And, but recently, we haven't been talking about family planning as much as we should. You look at the population is growing exponentially. So that leads into my next question. It's about family planning. And I'd like Jennifer Ayanta from Society for Family Health to take this question. Can you tell us if there is a link between family planning on one side, maternal and child health, and education?
I think definitely there is a link. Now, if you look at all the studies that have been done, like Hajia Meru has said, the NDHS, the NAR, the National AIDS and Reproductive Health Survey by the Ministry of Health, all studies point to the fact that if a woman has secondary levels of education, she's more likely to use a method of family planning. Now, the other thing about family planning is because a woman puts space between her children, she has time to recover from her health, the health problems that she had delivering that child. And then the child also has a chance to be exclusively breastfed for 18 months. So it becomes healthy. And then she has some time to be able to put that little gap that a woman needs for her body to recover from the whole point about delivery. So of course, education has a link with maternal mortality, or rather maternal survival. Because every woman that gives a gap, and what they found out is that there's a gap between children, that those children, the child coming after is more likely to survive if a woman puts a gap between children. So the more space between children, the more likely there is for a child to survive. Now, what the studies do show us is that when a woman has secondary levels of education, now what's important about this is it's not primary level. So just educating a girl to primary level is insufficient to increase health outcomes. What's important is that a girl gets to the level of secondary school and finishes, and then she has a much higher chance of being able to, even as a couple, to be able to determine exactly what method she needs to use with the help of a health provider. So there's a very big role that communities can play in ensuring that maternal mortality is reduced just by simply supporting family planning.
Okay. I would like somebody else to take this next question. Thank you very much for that contribution. Very well said. And we'll call on Dr. Wanodi to pick this one up. We've talked about nutrition. Let's talk about immunization. And we want to know, is it important? And how do we get higher percentages of our children, including the girl child, immunized against diseases?
Thank you very much. Dr. Chizoba Wanodi. I'm the country lead for the Johns Hopkins International Vaccine Access Center. We work on supporting the NPHCD and the Ministry of Health on immunization programs. So I'm really familiar with the immunization program here in Nigeria, and I can say that in the last couple of years, the immunization rates have increased due to the efforts of the government and the partners, but there is still a lot that we need to do, because immunization, as many people know, is one of the most cost-effective health intervention. And if, for a girl child, immunization is important at every stage of her life. When she's an infant, there are about 7 different vaccinations that can be provided to her so that she can survive infancy. And then when she gets to an adolescent, there is also a vaccine called the HPV that's available to prevent future cancer in her. And I'm aware that the Nigerian government is interested in, introducing that vaccine into the program. And then when she becomes a mother or she's pregnant, there's also tetanus toxoid that will protect her unborn child from tetanus. So immunization plays an important role in a girl child's life. And there has been studies that have shown that immunization actually does have an impact on education. We've been talking about education on health, but there is actually a relationship between health and education, because you find that a healthy child is more likely to learn better in school. And a professor at Harvard has done this study, Professor Bloom, where he found that children who were immunized actually had higher cognitive function, and at the end of the day, they performed better educationally. So education and health, I say that they are twins. They are brothers and sisters, two sides of the same coin. And the efforts we put in health and in education will bear fruit for both. You talk about every girl should be educated, and I see that there are opportunities within the health sector where we can actually identify in communities where girls are not being educated. The health sector has reach into basically all the communities and all the homes. So we can use some of the health programs to ride on some of the educational programs as well. Before I close, I want to touch on something that may sound a little bit indelicate, but I think is very important for the girl child. And that's the issue of hygiene for the girl child. You find that there are some of the aspects of being a woman that is not well taken care of for the girl child. So some girls, I understand, are reluctant to go to school because there are no sanitary facilities for them. Why boys can use, outside and everything, girls cannot. So part of the strengthening the educational system, I think, will be to ensure that the facilities are made gender friendly and gender accessible. If I may stop there,
Thank you.
think, yes, sir.
I think Dr. Kudo will recall that during the session that the girls had here on Friday, this was a major issue. They raised it on their own. Facilities available to them in school. It's very important. And yes, indeed, some girls are reluctant to go to school for that same reason.
Absolutely. Yes, you're absolutely right. The girls did raise that. So I do want to take this opportunity to pull in the representative from UNESCO, Dr. Alido, who's here with us. You're hearing about all the linkages between health and education. Your sphere, your area of expertise is education. So I'd like to hear from you, and then I'm going to jump after you to Tokumbo Durasara from Owando Foundation, and then to Dr. Salma Abasi to give us their feedback on what you're saying, as you are the sort of key expert on education on the panel. What do you see as the major barriers to achieving some of these interests that we have in using the educational platform to address health, as well as ensuring that people are healthy enough to get a good education? Can you give us your perspective? What are some of the barriers that we need to overcome that will allow those synergies to happen?
Thank you very much. My name is Seydou Jallo, Dr. Seydou Jallo, representing the UNESCO Regional Director, Professor Hassan Alidu. She's the professor,
okay.
Not me. But I'm a specialist in education as well. Now, I've heard a lot said about health and education, nutrition and education. They're all very, very closely related because obviously a healthy child will not attend school as much as possible, where he's able to crawl to school and attend, he cannot concentrate as required. Similarly, a hungry child really cannot concentrate in class, and some evidence has been proven there. But one of the major, or some of the major constraints to using health and so on nutrition to further education, or education to further health and nutrition goals, is ignorance, lack of education and ignorance, in some cases poverty, and poverty tied to ignorance as well. These are two key issues, key factors, because if a parent is not literate, hasn't gone to school, or has not gotten the education level, like my friend there said about secondary school level, to start primary school or below, her understanding of issues of the health of the child, or the importance of vaccinations or inoculations and things like that, could be wanting. Therefore, she would not bother probably to send the child for the regular vaccinations. Poverty comes around, is linked to many other factors, sociocultural practices, poverty itself, where rather than send the girl child to school, there are more immediate needs of the family where revenue or money is required for survival. You ask her to go hawk in the streets. That child is missing out in school completely. Solutions to these are varied. You can have many people looking at different aspects of it to say these are solutions, but I know that one of the UN organizations here is doing some cash transfers, and government also is doing some cash transfers. That is important. It will at least enable some families that are in need to allow their children to go to school. You see, that is important. But somebody also mentioned about listening to the girl child and listening to their parents. That is also very important, to know exactly what really the problem is. But cash transfers is an immediate, like your first question on education was, what are the immediate things we can do? I had expected that, but we still don't know, but I was hoping to say something on that. But this cash transfer is one of the solutions, or the potential solutions to that.
I want to stay on with you before you pass the microphone, to talk about a subject that in our society, which is still traditional to a large extent, we don't talk about sex education. I'll give a little anecdote. My mother told us a story of her mother. The extent of sex education was this: called her aside and said, if a man, I'm translating now, if a man jumps over you, you're going to be pregnant. If I use the Igbo word, you would understand it, but the only way I can translate it, nyefegi, is jumps over you. So my mother was lying around the school field, and a boy did jump over her. She went screaming. She was inconsolable. As far as she was concerned, she was now pregnant. So that is it. And still, we don't talk to our children about sex. In school, it's not being taught. What are your thoughts about the need for education and sex education? And it all, again, brings together these two major components, health and education. What are your thoughts?
Thank you, Madam. Sex education, as understood by different communities, can be problematic for some cultures or some societies or some communities. However, I know that UNESCO, along with UNFPA, have supported, around the world in Africa, have supported family life education programs, which talks about family life, and of course talks about puberty, that period of critical period of a boy or girl's life, and sexuality and all that, and how to avoid unwanted infections, and even pregnancy, unwanted pregnancies, and so on, are talked about within that context. But it is not called sex education. I believe in a lot of communities in Africa, if you mention the terminology sex education, you will not go nowhere. You will go nowhere. Yeah. That one, they will probably pursue you with sticks. But family life education, that idea is about family life, and then in it you teach these realities of that period of a boy or girl's life when they can be very vulnerable. If they take the wrong decisions, it could have very serious impact on their lives. So yes, it is important. UNESCO is supporting that, family life education, sexuality education, just like I know UNFPA has done in some countries where I have worked before.
I'd like to bring in the former Speaker of the Children's Parliament, Chinenye Nwaneri. Did you learn anything in school about sex? Was it? I know the way I'm putting it, and I'm sure you understand. Did they teach you? Were you allowed to ask questions?
Thank you very much, Ma. I think the first and only sex education class I ever had in secondary school was in SS3 when I was about to graduate. And in fact, it was an NGO that came to the school to ask for permission to just tell us, that as we're going into the university, we should just keep ourselves. And the way it was all kept and, some words were not used. Yes, it wasn't so obvious to us. I was like, why are these people making a fuss about nothing? You just go to secondary school. What will happen? Nothing will happen. But until I actually got into the university and I found out that the pressure is actually a lot much more than we are told. And if not for the background I have from family, I guess one could easily fall by the wayside based on that. Can I make a contribution to what has been said?
All right.
I know this session has already gone like midway, but I would not be happy with myself if I don't at this juncture say this. This is the more important part of this event. The beginning was what I call in the youthful language, paparazzi. This is the main event. And I want to plead with everybody from the depth of my heart. Please, take it as serious as you can. And there's something that where everybody in Nigeria is used to. It's the responsibility of government. And so people are here sitting down, okay, let's make contributions, then we'll have a communique and then government to implement it. No. Please, before you go, make a decision in your heart to do just, even if it's one thing that can directly impact a girl child around you. We live, and I know that everybody here to some extent is not living below $1. So there are some things, even as a student, from my allowance, there are some things I can do to help somebody. Last 2 weeks, a girl died just in my department. A little girl of less than 10 because she was selling granules, and she's a girl. And she was electrocuted to death. And the trauma was just so much, and I felt like I had an exam that day. Only God knows how we're going to fend the exam, but I know how I felt. Because since 6.5, I've been coming for programs, we fight and we talk, but it's as if everybody keeps waiting for government, and I keep asking, how many things will the government do? We know that we're in a developing nation. We can't expect the government to do everything. And also, please, I want to also say some practical things. I feel when it comes to education is in two parts. Education involves schooling, and it also involves teaching people. Education, not all the time, could be through schooling. There's informal education, but I guess what we are advocating for is more formal education. But I would like to point out that it would be out of place somehow if we're trying to bring girls to school, or let me say children to school, and the standards of the school are not are not high enough to train the people we're bringing to school, especially for girls. When I was invited for this program, I asked a few people around me, my colleagues, my classmates, some people, okay, so after school, what next? The girl child has been mentally trained that let me just go to school, let me just get the certificate, and then I will marry a good man, and then my problem is over. And that is why they don't get educated. Please forgive my bluntness. Most of the girls in school are not being educated, they're just being schooled. They just come into class when they want and they go, and there's no education. You see girls and they don't behave like they're in the university. So please, I would like to say, when we go home, even the public, media, I know of one, during NTA News, one newscaster used to ask the parents, where is your child? They should, yes, they should start asking, telling the parents, this is it, where is your daughter, where is your child? I know at home some parents would prefer the son to sit and watch news while the girl is washing the dishes for dinner. But instead of that, it could start from the home. Let the media tell parents, okay, teach your son that his sister is his colleague. The day that a boy refuses to go to school because his sister is not going to school, the parents will send the girl to school. There are so many little things we could do. And then on a final note, one thing that is lacking in Nigeria is mentorship. We have a lot of women that are up there. I don't know how my other colleagues or female folk will feel, but I know that if a big, achieved, accomplished woman should just come and say, I'm not coming with all the siren and everything or noise, I'm not going to make a show, I'm just coming and we're just going to sit down and read. So as much as you can read, that's how much you have my presence with you, or I'm just coming to talk to you on a one-on-one basis. Mentorship, it will give a lot of motivation to people to do more, because when we're patriotic, I know that a whole lot more will be achieved. Thank you.
Thank you. I was going to say let's give her a round of applause again, but I think you've already done it. You beat me to it. Thank you, Chine. You came with your brain full and you've offloaded. Well done. That's excellent. Excellent interventions. I want to pull in, because you said it's everybody's job, right? So everyone should do their part. We have the private sector taking a role in educating people, adopting schools. I'd like to hear from you, Tokumbo, your response to what she said about everybody taking their part, and also what Madam Onyeka said about teaching sex in education in school. Do you all do that? And how is it that private sector, who else could we cajole to go into that space and take responsibility for community schools? Since the Oando Foundation is doing it, how do you structure that kind of partnership?
Okay, first of all, Chinyere, I believe in a couple of years' time you should have my job. I should not be sitting here, because you spoke fantastically well. And you understand the issues, and coming from you, it just brought it to life again. You hear it, but having you say those words, having your thought process captured in this room today was excellent. Yes, we're a private sector, and we work with the government. We have to make it a public-private partnership, because you have to think about sustainability. If you just do it as a private sector intervention, where is the sustainability? And the way we work with the government is we don't go in to say, Oando Foundation is coming here. We tell them that it's a partnership. And I mean, touch wood, we've been very lucky. We have some state governments that have said, okay, you renovate the schools, we'll provide the furniture. They do have funding. It's not as if they don't have funding. It's just to work with them to structure how they're going to spend those funds. If you continue to sustain them, where are their own funds going? Every state has to have a school plan. I know some of the reasons some international donors don't sponsor states is because their school plans are not in place. So we have to work with the government to make sure the school plans are in place. So it's a public-private partnership. Once people see the private sector, they back off, and that kills the system. So we can't afford the system to be killed. In terms of sex education, I think I've learned a lot from here. My problem is Oando Foundation is doing public primary education. I need collaboration. I need the health workers here to also come to my schools, because I can't do it all. I can't be a jack of all trades. Once I start doing that, I lose my own main focus. So I think the health sector should partner with the education sector, and more private bodies should come on board. So Tokumbo organization can take health in this school, Akudo's company can take something else in the school, because that way we would reach a wider audience instead of one organization saying, oh, I want to do everything. I think we should...
That brings me to my next question, and I'd like you to give the microphone to Dr. Salma Abbasi. Dr. Salma Abbasi, over on this side. After you, I think we would like the Honorable Minister to also give us his own side, because right now you're representing government. Talk about synergy. No, it's a good thing. talk about synergy. It's quite obvious this should not be left to government alone. We all know that. You've said that before. Now, how do we bring together all these groups, going back to the traditional society, the chiefs, the religious leaders with their concepts of what the good books say, and government? You've had extensive work, so let's hear you.
Thank you very much. First of all, I want to tell you that what I'm going to say now is practically living in Kaduna, and I would like to invite anybody to come to Zaria and see what we've done in partnership with the Ministry of Health and the Ministry of Education. We've used existing resources from a rural PHC and a primary school, because change can only be done when you talk about sanitation and hygiene in the minds of little children. Otherwise they will adopt the habits of the elders. So we picked the community with the worst health indicators, where they had death from typhoid and cholera. So the community was ready to say, help us. So with public-private partnership, as a private organization, we identified to the two ministries, you have this and they have that. Let's put it together. I think the lady mentioned it about immunization. You have access. We did focus groups with the mothers, with the children, with the traditional leaders, the religious leaders, with the imams. We listened to their issues and then brought the PTA in and said, we will not give you money. This is for your children. You need a borehole. You need to have toilet facilities, ablution facilities. We then created for them with the children, bringing the children's words on toe. The girls had also learnt from the mothers that my other daughters are now adolescent, they are in puberty, they cannot go. So this year now we're launching another program called Menstruation Hygiene Management. The commissioner or the Ministry of Health said, Salma, can you talk about other things being sex education? Very difficult subject, but we are bringing it into our text or our curriculum on this in a very gentle and subtle way that is not going to be offensive to the religious leaders or to the homes themselves, to make them feel that these Pretoria is coming to exploit our girls, sexualize the girls. So it's a very good harmonious mix of listening to the fears and bringing in the communities that they trust and bringing in the government organizations that have the charter.
Honorable Minister, do you not think that your job will be made easier with this kind of synergy going around?
You could see I'm very comfortable here. I think the panel discussion is quite interesting and is bringing out a lot of us, and what requires to be done is action. And I think broader issues are being brought out. Certainly cannot be left alone to government. That one is settled, and already private sector is partnering with government at different levels, national and sub-national levels, to do quite a lot of things. Then I also want to put into perspective some of the things being said. I kind of look at education as located at one extreme pole of a spectrum in the economy, and then the outcome of everything is health. And sometimes when I speak on, to the public, I said, I'm not minister of disease, I'm minister of health. But sometimes, given where we've been coming from all over the world, sometimes they want to restrict us to be minister of health services. I think someone mentioned that health is beyond the management of diseases. And I think all the discussions, all will end up in good health. So education is the foundation. It's the education that will produce an engineer. It's even education that will produce a good musician, I dare say. You were one, and you are still one, because you were operating with masters, and so you kind of was operating at a different level. But in between education and health, you have several activities that will all lead to health. Sometimes they blame the Minister of Health for so many things. The lady who just retired as a director somewhere is not being paid her pension. She develops hypertension, develops diabetes mellitus because she has several children she has to cater for. And then she has a stroke, and they are blaming the health sector. So the point I'm making is really that what we are saying is correct. Then talking about sex education, I think coming out of this meeting, DG, set up a multidisciplinary committee right away to produce what will be acceptable. It takes time. There'll be argument, and sometimes justifiably so. I've seen in some other countries, some of the things being taught as sex education. Many parents, even in Nigeria, will object to it. Even the government will object to it because people are going beyond bounds to introduce things that my psychiatric colleagues will say, look, hey, those are cases for us. And the world too is beginning to lose the difference and trying to get the psychiatrists not to have any job. Because things that ordinarily should go to them now being considered absolutely normal. So there's need, I think that's one of the things we need to do practically. Set up a team, get the faith-based leaders, get traditional leaders, get health, education, social welfare, all manner of people, a tight team, let them work over a few months, present it. Of course, there'll be arguments to different groups, but I tell you, after 1 year, you have begun a good journey. I think that's what we need to do.
Thank you very much. Dr. Amazigo, you have a comment. Amazigo.
Thank you, DG. I just want to make a suggestion on the issue of the girl-child education. There is also a foundation in Nigeria that is investing a lot in the girl-child education, the T.Y. Danjuma Foundation. I remember they've done a fantastic job in Bauchi State for the Marjorie girls' child, building a school, building houses for the teachers, sinking boreholes. So I was there and I saw what they are doing. So this is another organization that the your group can also bring on board. Then what I think you should consider is the possibility of creating a public-private partnership for the girl-child education. There you have to pay close attention to the governance, because if it's a public-private partnership and then you make government the governance of that public-private partnership, it will fail. If you allow the private sector to also be part of the governance of that public-private partnership, and then you structure it in such a way that even communities would play a part, or traditional rulers, or whoever that is not in government, that is truly a public-private partnership for the girl-child education. I think we can not only raise resources for that, but also go much deeper into the problems of the girl child and begin to address those problems systematically and for a long time. What I think is a big problem in our country, Nigeria, is the strength to follow through on good initiatives. We start a good initiative, within 5 years, because there is a change in leadership, we destroy that good initiative and we want to start a new one. I think in the girl child, we should not allow that to happen. For example, what the First Lady gave us today is a big bonus when she said that this summit should be an annual event. We should not lose track of it. We should not allow politics to take that away from us. We should allow the girl child the opportunity to have a summit every year, and next year let them be more in number than we, the mothers. Thank you very much.
Thank you so much.
Thank you. Go ahead.
Just to quickly add to that, one thing I must say quickly is, when we adopt schools, before we even renovate the classrooms, we put toilets in, and enrollment almost quadruples. It's amazing, because the building is falling down, but there's a sanitation system. So what they've said is, I've seen it in real life. Just to add to what she was saying. We've also made, Wando Foundation and British Council just went into a partnership together to bring 230,000 girls back into school in the next 3 years. They're going to be doing the advocacy part, using a lot of radio, looking at the traditional rulers, speaking to them. On Wando Foundation's part, we will get the school ready for the kids to be able to have a conducive environment to learn.
Very good. Thank you. I do think that it's important to get back to how does all of this tie into survival rates for the girl child. She needs to be alive, healthy, right? She needs to be able to manage herself, manage the child, the process of giving birth to other children. So how do we tie in birth rates? I think we have one of the highest fertility rates in the world. And notoriously where I'm from, in Imo State, has, I think, one of the highest in the eastern region. So I'm very aware of the issue of having lots of children and the burden that that places on our ability to give good education, have children survive past the age of 5. Can we get back to that? I'd like to hear from Dr. Jennifer and then Dr. Mero on that. And then I want to go back to some of the barriers we experience with immunization, especially in there's some pockets of parts of Nigeria where it's hard to get people immunized. And generally, immunizations are low, immunization rates are low across Nigeria. So let's also hear, how do we overcome